like all pyramid schemes, there's a starting point. And the thing with pyramid schemes is that the people at the top are the ones who benefit the most. So everything begins in utero. It starts with your parents having a thought that, hey, okay, my son is going to be a doctor. You're not yet even born, but people are already thinking on your behalf, like, he must be a doctor. And then you're born. But at this point, you just want breast milk. But there are people calling, oh, doctor. And instead of pinching your cheeks and saying, buju buju, they're like, oh, he's going to be a doctor. They're starting to cook you, but you're not saying it. Now you're in P2, and you're just trying to conceptualize the alphabet. You're trying to understand how letters are. But then people are already seeing you as a doctor. Whenever you go back home, they're calling you Dr. Aine. You know, they are cooking you, you're not seeing. And it's even worse when your parents are doctors, because like when you go back for holidays, like normal kids are playing with toy cars, toy dolls, everything. You're playing with a stethoscope, a lab coat, injections. Like they're building this image and you're not seeing it. Then you get to like P4 and you develop interest in the human skeleton. You want to learn the human skeleton. Which P4 kid is interested in studying the human skeleton? Which P4 kid likes studying about the human skeleton? Typical psychopathic behavior. So, okay, you finish, then you get to high school and you're walking around cutting rats, cockroaches. In high school, people are going for MDD classes, functions, then the sports team, like how normal kids are. But where your interests are, moral concept, anatomy of a cockroach, like this is high school. You're already cooked at this point and you only have one path to become a doctor. So you finish high school and you passed. So you got a Bachelor of Medicine and Bachelor of Surgery at the university. Lesson 1, before you even know your neighbor's name, what your neighbor is called, it's Anatomy 101. There's a cadaver in front of you. Cadaver is what we call them so that we feel good about ourselves and what we're doing, but you're dissecting through a cadaver. Day 1, you're cutting through. The dead are teaching the living. And this is where things start going astray, but you cannot stop at this point because you've already moved a very long way now. You're in year 1, medical school. Everyone at home now calls you a doctor. My son is a doctor, they're in medical school. But things are not yet making sense. You also don't know what you're doing, yeah? They're bombarding you with a lot of information. You go through the clinical years, you finish. You even start calling yourself names, senior clerk, I don't know what, so that you feel good about yourself. You feel like you've reached, but have you reached anywhere? Now remember, medical school, you're a senior clerk. But the moment you join internship, you become a junior house officer. So which profession do you come from senior to junior? I don't think you guys see, but the problems start coming up from here. So now you're an intern doctor, a junior house officer, and now everyone thinks you're a doctor. But in the circles of doctor, you're the least senior. You're like the one who knows the least, the least important, but the one who is overworked. 7 days a week, no public holidays. You're trying to accumulate as much information as you can in a very short period of time, 1 year. And in some countries at the same time, you're fighting to be paid, because in other professions, they don't understand why we should pay an intern. Because in other professions, intern pay, or they beg. But in this one, you must be paid because you're doing most of the donkey work. And that's the whole thing about internship. Being a donkey and being proud about it, yes? So we are still moving. The 1 year ends, you've finished internship. Now you get a glorified title, medical officer. Now most people here think they have reached because everything has made sense. You're a medical doctor, a medical officer. You can do things. But can you actually do things? Because the thing they told you in internship is when internship is done, you go out and conquer the world. But which world? You just realize there's this thing called specialization that has killed everything. No one wants to associate with a medical officer. Like, even patients know when they come to see you, they'll be like, oh, I would love to see a specialist. But I'm like, was this all a lie? Was it a lie, actually? So things start whispering in your head, like, you need to go back and specialize. You need to go back and study something. Like, you have just finished school, but then there are voices in your head, they're like, go back and study more. Because they also say, if you end as a medical officer, then all this was for nothing. So you actually have to go back and study. So you're back to school again. But this time it's different. You're no longer those juniors, but they even call you senior house officer, master's student. You're here to specialize. And this part is interesting because this is the part that defines your legacy. So if you choose to be a surgeon, physician, this is how we shall know you. This is your legacy. You understand? If you choose to do pathology, your legacy will be dealing with the dead, and you decide whatever you do. So you're almost him, you're almost there. And then 3-4 years down the road, you're done. Now you're a specialist. People understand you. People can actually recommend you. They'll be like, oh, you go and see him. He studied this. You can actually choose to study something very small like the human eye. And that is how we shall know you for the rest of your life. Yeah. So you're done 3, 4, 5 years and you're him. You actually think you're him, but you're not yet him. Because ideally you would finish and become a consultant but then you have to first wait a little bit more, because now you're an associate consultant. Like, yeah, congratulations for finishing, but we need you to practice for a few more years before we can give you the consultancy title, so you still have a little bit of time from associate to consultancy. And even if you go to the other path of reading books, you're still an associate professor or to professor emeritus. So you guys see the pyramid scheme, like it keeps continuing up to death. 40 years later, and you ask yourself, was it actually worth it? Is it really worth it? And I hope it's actually worth it for all of you chasing this. Because if you're watching this video right now, you're already in the middle of the pyramid scheme and you cannot quit. So I hope the best for you in your endeavors. Thank you for watching.